Welcome to the Friday Value video, and we are currently in a mini series on back pain because I had not presented this in several years. So this is part 3. And in this part, we're going to talk about manual techniques. And I want to go into a little bit of a detail about what these are and why they're so powerful. Now, we already discussed the McKenzie program, and I mentioned why that's under the manual as well as self-care. But we're going to talk about the other 3: muscle energy techniques, strain and counterstrain, Mulligan's mobilization with movement. These are phenomenal techniques that I used for decades extremely successfully with my patient population. So there's an issue with biomechanics, which basically means joint function, joint motion. How are your joints working? How are they moving? And you can have an asymmetry. You could be rear-ended while sitting at a red light. You could be jumping out of the back of a pickup truck and land harder on one leg than the other. I mean, there's a lot of different reasons. As a kid, you could have fallen out of a tree. I used to climb trees all the time when I was little. My mother said when I was 4, if she couldn't find me, I was up a tree somewhere. So it's just, we do a lot of things physically to our body, and these aren't things that are going to show up on an x-ray. It's not going to show up on imaging. You need to find a skilled clinician who is trained in palpating your joints, your bones, and figuring out if the alignment is in error, if it's in asymmetry, and then they can help you. So we want to correct those biomechanics. We want to restore that biomechanical symmetry, and manual techniques work. Muscle energy technique is my favorite go-to technique. It is phenomenally successful. It is a comprehensive manual therapy system. It evaluates and treats joint restrictions of the spine, the rib cage, the pelvis, and all your extremities. Any joint restriction or impairment of muscle length and strength anywhere in the body, this can be phenomenally successful. And you are analyzed, you're diagnosed based on palpating, precise physical diagnosis evaluation, and then it's identified, the issue is addressed. And the reason it's called muscle energy technique is because you are put in a very specific position, and the clinician uses very light to a moderate force where you will contract your own muscles against their hand in a specific position. It's very precise, very controlled, and it is generally pain-free almost 100% of the time. And the only time it might not be pain-free is because the position you're in might cause some slight discomfort. So it's been around for, oh my gosh, over half a century, 3/4 of a century. It's a widely performed osteopathic technique, extremely successful. And as I said, it is meant to correct the alignment and to restore the biomechanics. And it has been seen very successful in joint restrictions pretty much anywhere in the body. Now, there's also something called strain and counterstrain, and then arose by any other name. Some people will call this positional release, but what you are doing, I don't know that positional release is exactly strain and counterstrain. I studied from the Jones Institute. Lawrence Jones is the creator of this technique. He's long since passed away, but because this technique works, there are still entire organizations teaching this method. And what happens is you get this little false message where the muscle's kind of stuck in this strain pattern and it can't relieve itself. And when the muscle is shortened as much as possible passively, which means someone is positioning you and you're not actively creating that position, in 90 seconds, it can stop that strain in that muscle and relieve the tension. It can be phenomenally powerful and successful. And if there's a neurological issue like a post-stroke, it can take 120 seconds. However, I've seen this be so almost miraculous with people. It's amazing. And as I said, you passively shorten the muscle. And sometimes your body in a normal position can suffer this pain for literally decades. But I've seen it stopped in 90 seconds when this technique is used and used correctly. And then the last one I want to mention in this particular part 3 is Mulligan's. I say Mulligan's mobilization with movement because this was determined by Brian Mulligan, a physical therapist from New Zealand, very, very skilled, brilliant man. And what this does is this particular technique uses very passive mobilization with active movement. So the clinician will put their hands on your joint in a very specific way, and then you will do the movement. And it is meant to be completely pain-free. Sometimes the pressure of the clinician's hands can be a little bit uncomfortable, but it can restore complete mobility. I've seen it restored in one treatment. Usually it's just a few. It is immediate pain relief. It is immediate increase in range of motion. And I've seen it to be beneficial for pretty much any painful orthopedic condition that has a limited range of motion. It can work really well for all of these issues. So, um, there is so much out there. You want to be informed so that you know the right questions to ask. Next week in part 4, I'm going to cover some self-care techniques, and you will be more informed by the end of this series. I'll see you next week.